Hello everyone, welcome to my channel Capsa. Today we will learn about anticholinesterase poisoning or which is known as organophosphorus poisoning. Anticholinesterase poisoning or organophosphorus poisoning. Okay. So what is anticholinesterase? What do you mean by anticholinesterase? Anticholinesterase are the drugs, okay, that stimulate cholinergic transmission indirectly by inhibiting the enzyme acetylcholinesterase or increasing the level of acetylcholine in the postsynaptic neuron. If we inhibit the acetylcholinesterase enzyme, obviously the activity of cholinergic system will increase. So, anticholinesterases are drugs that stimulate the cholinergic system or cholinergic transmission indirectly by inhibiting the enzyme acetylcholinesterase or cholinesterase or increases the level of acetylcholine in the postsynaptic neurons. Now, what is postsynaptic neurons? We will see through a diagram. This is the synapse or the junction of two neurons. This is the pre-neuron and this is the postsynaptic neuron. Presynaptic, postsynaptic. Acetylcholine is produced in the presynaptic part and binds with the receptors which are present in the postsynaptic part, that is nicotinic and muscarinic. Okay. Now, what is acetylcholinesterases? So, acetylcholinesterases are the enzyme which hydrolyzes and inactivates acetylcholine in the synaptic clefts of the autonomic nervous system. It can be the central nervous system or it can be the neuromuscular junction of the somatic nervous system. Neuromuscular junction means where neuron and muscle are attached. Okay, so neuromuscular junction. So acetylcholinesterase are enzymes that hydrolyzes and inactivates the acetylcholine in the synaptic cleft. Okay. Autonomic nervous system, central nervous system or NNG or neuromuscular junction of the somatic nervous system. Now, we will understand this through a diagram. Acetylcholine, when hydrolyzes, it produces acetate and choline. Okay. With the help of enzyme acetylcholine esterase or cholinesterase enzyme. And this acetylcholine molecule Again forms from acetyl-CoA plus choline with the help of two molecules. And the enzyme which forms this acetylcholine is choline acetyltransferase. Now, what are the type of acetylcholinesterase enzyme? So, these are actually two types. First one is true cholinesterase, that is acetylcholinesterase, and second one is pseudocholinesterase, that is butyrylcholinesterase. Acetylcholinesterase is also known as cholinesterase enzyme. Okay? Butyrylcholinesterase. Okay. Now, what are the type of anticholinesterase drug or cholinesterase inhibitors? Okay. Now we will look the types of anticholinesterase drugs or cholinesterase inhibitors. These are actually two types. First one is reversible and second one is irreversible. Now, what do you mean by reversible? Reversible is when these drugs bind with cholinesterase enzymes, it releases after some period, that can be minute to hour. But in irreversible, when it binds with cholinesterase enzymes, they form a permanent covalent bond and obviously need a replacement to break this bond. Okay, so what are the reversible inhibitors and what are the examples of irreversible inhibitors? I will provide few examples. You will learn lot of examples from the books. Okay, so physostigmine and neostigmine are the reversible inhibitors. Among these, physostigmine is natural and neostigmine is synthetic. And irreversibles are organophosphorus, that are malathion and parathion, etc. Now, these acetylcholinesterases obviously easily available and extensively used in agricultural and household purpose. So, obviously there is a chance of poisoning, accidental, suicidal or homicidal poisoning. If this kind of poisoning occurs, we need to go for a treatment. So, before the treatment, we need to look about the sign and symptoms. So, what are the sign and symptoms? We will understand this, okay? So, the sign and symptoms are lacrimation, salivation, sweating, fall in BP, blurred vision, bronchospasm, ataxia, tremor, etc. So, these are the main signs and symptoms, okay? And slowly it leads to vascular collapse, then respiratory paralysis, and obviously it leads to death. So, obviously we need to treat the patient. So, for the treatment, we need to obviously control the or maintain the normal level of airways. Okay, so maintain the airway or breathing. Okay, Second is termination to the exposure. Okay, so termination to exposure. Third one is, we have seen in the sign and symptoms that tremor occurs. Okay, so if tremor occurs, we need to obviously treat the tremor or convulsions. So the third point is control the convulsion with the help of medication, anticonvulsive medication. Okay. And the last one is with the help of medications like atropine and cholinesterase reactivators or oximes, that is pranidoxine or also known as 2-PAM. Okay. So this is the end of my lecture. If you like my lecture, please do like, comment, share and subscribe. Thank you for your attention.